Welcome to the Healing Grove podcast. I'm Dr. Kristen Ryman, an integrative holistic family physician, author of Life After Lyme, and host in this virtual space of learning, healing, and growing. I believe humans are like trees, and our physical limb is only one of many. Health on all limbs of the tree, emotional, conceptual, social, spiritual, is absolutely required for the whole tree that is you to be vibrantly well. I created the Healing Grove podcast as a place to showcase some of the world's best integrative and holistic medicine, to expose you to transformative tools and mindset shifts for all limbs of your tree. I hope you enjoy our conversation in the Healing Grove today as much as I enjoyed having it. Hey everybody, welcome back to the Healing Grove podcast. I'm really delighted to get to have this conversation with you today, Kim Witczak, and just to explore some of the issues that you've been learning about and teaching about for the last almost 20 years, right? 20 or more years. So everybody, this is Kim Witczak. She's a leading global drug safety advocate. She's a speaker, and she's on a mission to raise awareness of some common side effects of commonly prescribed medications. To this end, she's served on the board of directors for the National Physicians Alliance and the Medication-Induced Suicide Prevention in Memory of Stuart Dolan Foundation. She's an active member of the DC-based Patient, Consumer, and Public Health Coalition, which ensures that the voices of non-conflicted patients and consumers are represented in healthcare and in FDA-related legislative review processes. And Kim has co-created and organized an international multidisciplinary conference called Selling Sickness, People Before Profits, that took place in Washington, D.C. in 2013. In 2016, she was appointed consumer representative on the FDA Psychopharmacologic Drug Advisory Committee. And I want to get into the details about that because I'm super curious about how you get on that, who's there, what conflicts of interest might be there, all of that. So before we do that, I just want to say, like so many people who are leading healthcare or health-related movements, Kim's journey started when she was touched personally by a tragedy related to an undisclosed drug side effect of an antidepressant. And we will talk about that story in a moment. And actually, why don't we just start there, Kim? Let's start with your story and Woody's story, if you don't mind, and share how you were thrust into this world.
Sure. Well, first, thanks for having me. I love having these conversations because I think they're really, really important because they have real world impacts. So like you said, most people I would never have chose to go do this work. It's why I call myself the accidental advocate. And I say that because sometimes our greatest purposes choose us. And this is one that chose me. On 20, it's hard to believe it's going to be actually 22 years this summer, but my life looked very, very different. I was married to my best friend. My husband, we were married for 10 years. We're about to have kids. We both had successful careers. I'm in advertising. I still am in advertising. Wood had just started his dream job with a startup company. So life was looking good. And I certainly had my life all planned. Like it was exactly like I was telling God how it was going to work. However, on August 6th, 2003, I was out of town on work and I hadn't heard from my husband all day. So I called my dad. I'm like, hey, Dad, do me a favor. Will you just go check and see if Woody's at home? Like he's been having trouble sleeping. I'm just afraid he might have hit his head. And I'm literally will never forget the call. My dad calls. I step out of our studio where we were shooting and my dad's like, it's bad. It's bad. He's screaming. And I'm like, what do you mean it's bad? And he's like, he's dead. And I'm like, what do you mean? Like, how do you know? Like, how do you know he's dead? Like, how do you know? And he goes, he's hanging. And I go, like everything in 1 second and one word, my whole world blew up. It was almost as if like it shattered. I can see it like literally shattering everything that I knew. My head like spinning. And I was like, what? Like I couldn't even wrap my head around that Woody was hanging. Woody loved life. He wasn't depressed. He had no history of depression. So it made no sense. Like I never would have left to go out of town. But it's funny when that night when when I was in Detroit trying to figure out how to get back home, the coroner got on the phone and asked me one simple question: was Woody taking any medication? And the only medication he was on was Zoloft, which is an antidepressant. And she said, we're going to take it with us. It might have something to do with his death. That was clue number one. Clue number two, the exact same night that Woody died, the front page of our newspaper had, Minneapolis Star Tribune had an article that said the UK finds link between antidepressants and suicide in teens. And literally, those were the two things. Woody did not leave a note. We left notes all the time for each other. And I remember everything intuitively in my body. There's like, no way did Woody kill himself. There's no way he killed himself. And obviously, my dad at this point called my mom and my sister, and her husband came over. And so the whole family was at our house. And that night, as I'm like, don't even know who I am anymore. My brother-in-law is like, something does not make sense. He Googles Zoloft and suicide and had no idea that in 1991, the FDA held hearings on the emergence of violence and suicide on Prozak. And all of those members on that advisory board took money from pharmaceutical companies that made antidepressants. And they're like, even despite all the families that came forward, they all went, nope, we don't see anything. And so they did not do anything to do with warning. The FDA said, hey, we're going to study suicidality. They never did, they never followed up with the company. Meanwhile, now it's 2003, Woody died. Now we have Zoloft on the market, and we have Prozak or Paxil on the market and being used for kids. And so that became, so Eric, my brother-in-law, started just gathering information. I come home, and let me tell you, for people who've had grief, like that heartache is real. Like I remember after like the funeral, and I had all these posters of Woody, I'm like bawling, crying, and like trying to literally scratch out the pain. Like I had scratch marks on my pain. I kept praying, God, take my pain and use it. It does me no good. I didn't even know what that meant, but I was just like, I cannot live with this, And so that really is kind of it's a pretty heavy story. It is and it's not a story. I mean, it was my life, right? But I have to say, starting from the beginning, like nothing, like we never at the time, Woody had just gotten the drug for insomnia, because 5 weeks earlier, because he had just started that dream job with a startup company, having trouble sleeping. And he went to his doctor, and the doctor gave him a 3-week sample pack of Zoloft and said it would take the edge off and help him sleep. I wasn't even in the country when he was on it because it was my busy time. Those first 3 weeks he was on it, I was down in New Zealand on a shoot. I come home the week, and I'll never forget something Woody did. Walked in our back door, completely drenched through his blue dress shirt, fell to the floor, hands around his head. Kim, you got to help me. I don't know what's happening. My head's outside my body. He's rocking back and forth, bawling. He was crying. He goes, I don't know if I can handle this. I don't know what's happening. And I remember we prayed, yoga breathing, called the doctor, and the doctor said, you got to give the drug 4 to 6 weeks. So Woody went from...
So wait, time out. Even though he'd never had any kind of symptoms like those before, his only symptom was, I'm having trouble sleeping.
Yes.
Maybe some ruminating thoughts keeping him up. The doctor said, this will help with your anxiety or sleeplessness. And then now here's Woody rocking on the floor, sweating with his head outside his body. And the doctor heard those symptoms and said, keep giving the drug. It takes 4 to 6 weeks.
Yep. And he said that is, when Woody was like, I don't know what's happened to me, I feel whatever. And he goes, well, remember, these drugs take 4 to 6 weeks to kick in. So, and that's what they tell you with the antidepressants. They still tell you that it takes time for it to kick in. And, I look back, and obviously I think about Woody, like Woody could not have Like he was a guy who could have his nickname with his friends were like Two Brew Tim, because he would have one beer and then the second one he'd be drunk. He didn't drink caffeine. He didn't take NyQuil because NyQuil really messed him up. And he was also deathly allergic to penicillin that he found out when his appendix bursted when he was little. So like he already had a sensitive system. I don't even know. And so clearly when the doctor's like, 4 to 6 weeks to kick in, Woody's thinking that he's losing his mind, like, I don't know what's happening to me. He goes, I literally feel like I'm outside my body looking in. And so I look back and I mean, as you can imagine, when something like that, which makes no sense, like I don't even think he knew it was an antidepressant, we just blindly trusted. He blindly trusted. We never questioned the drug at the time because his doctor gave it to him. It was advertised on TV as safe and effective. And like, why would a doctor give you something that would hurt you? Like, right? You assume that it's going to help you. And so I don't think, I look back and when you have something that is so like, and I'm sure anybody who's ever had something that doesn't make sense, you just start investigating because you're just trying to like, it's almost your own kind of your human response to trying to make sense of something that makes absolutely no sense. So you just start researching. So that's really the backstory. And then eventually that became Eric. Eric and I were like, this has to be our mission, is to go get warnings, put on these drugs. So we started a whole, like, we called it the battle for Woody, which meant back then there was no social media. So if you really wanted to get involved, you had to get on a plane. And so that's what we did. We got on a plane and headed east to Washington, D.C.
Wow. Wow. How did you even know what to do? Like, how did you know you had to get on a plane and what to take and who to talk to? Like, how did you plug into this whole world?
Yeah, it's that in itself. I mean, I feel very, very lucky that I had my brother-in-law that was helping me because I don't, and at this time, you got to also remember, everybody was saying, you can't take him down this path, but it literally ignited something. And so the first thing that we did is, well, remember that front page of the newspaper said the UK was like investigating. So like already there was something that you're like, wait a minute, if you're investigating, why aren't we? Because the UK people are no different than the American people, right? They're, we're humans. And so my brother-in-law, the first thing we did is we met with our representative in Washington, D.C., and told him the story and like connected us. Then we also were reading and I'm going to give a lot of credit to my brother-in-law because he was like, I know what depression is. I almost tried to take my life. This is not depression. What happened to Woody? Like he loved life. We started ordering books. And one of the books was something that was written about in the UK. It was this guy named David Healy, Dr. David Healy, who's kind of one of the leading renowned psychiatrists that blew the whistle way back when about healthy volunteers in studies that went on to kill themselves. So Eric bought a book, and in there it listed like, we're like, hey, he was like, we should have a lawsuit. So we contacted lawyers that were listed in the book and eventually got connected in this whole world. But I think it started with this relentless of like, I don't even know. So if I think about myself, and I'm going to tell your viewers, I was not this person before. I never I was the good girl sitting in the corner at school. I always had good little report cards. I never stirred the pot. I never would have spoke out on anything controversial because this at that point was controversial, meaning people are like, oh, I went to a suicide support group. And they're like, and literally the woman patted me on my head and said, oh, honey, we never see it coming. Like I was like a grieving widow looking for something, like trying to make excuses. And I'm like, no, like every part, it ignited something in me that I think is actually something that's in all of us, right? This like little light that's inside all of us that was like when something doesn't make sense. And so, yeah, I feel very lucky. And I'm going to say, we also had something that I think kind of was a bigger guiding force when we were throwing Woody's ashes out. So Woody always knew he wanted his ashes spread in the middle of Lake Michigan because that's where we used to live in Chicago. And so Eric and I, before we did anything yet, remember I'm crying, praying. Eric's praying about like, what do I do with all this information? And I have a box of Woody's ashes, which is super weird, holding, because that doesn't even make sense. But also we look down in the middle of Lake Michigan and there's this red book that's floating by, like literally a book like this, like Hollywood book. And I go, and it was flat right in front of us. And I go, does that say what I think it does? And he goes, yeah. In gold letters, it said, the Holy Bible. And it literally floated right by us. And thank God the two of us saw it because they would have thought I was crazy. But what it told me is like that there's a world way bigger. And it was like God saying, I got Woody, don't worry about that. Trust me. This is a bigger, bigger, bigger mission. And so that really was kind of our confirmation that we had to do something. And that's really at the point where we started going out to DC, and then, the rest from there. I'm not afraid to tell my story. I mean, I've always been behind the scenes, even in advertising as a producer. But I was like, if we can just tell a story and get the media, somebody to listen, that these are not, the safe and effective as they've been telling us. And then, I think when you said, how does somebody start? I think we just had so much perseverance. Like we were not going to quit. And we'd keep asking, like, who else can we meet? Who else do you know? Like, who else? And I think that was a big part of it. And ultimately, we did get a meeting with the head guys at the FDA, where I thought, we brought some other families who had the exact same thing happen to their kids at this point. And we met with the head of the FDA, and he said, literally, I thought he would be interested. Like, how did Woody go from this guy who didn't, he had no history of depression, to getting it for insomnia? 5 weeks later, head outside the body and then kills himself. I thought for sure, like when a plane crash goes down, I thought for sure they would be interested. And literally, the head of the FDA responsible for these drugs said, oh, well, he said, well, we didn't see those in any of the double-blinded placebo-controlled studies, which, by the way, the drug companies control. And he said, those are just anecdotes. And I'm like, anecdotes? Like, no, like these are right here. We had 4 families with us. These are not anecdotes. These are data points. Like, these are real world data points. And so I start learning that the whole system, like, I'm like, why wouldn't you be worried and care about the real world? Like, we're the ones that are taking it. We're coming to you. And so, yeah, that was an interesting. And then there were, at this time, there were starting to be congressional hearings. House Energy and Commerce did big investigations. I would highly recommend that if people are interested, they go follow them. And I've got links on the C-SPAN. They called because the FDA eventually did hold hearings in 2004, where it was families and families coming saying, you killed our kid. Media was lined up, security with guns. It was pretty intense. So I gotta imagine what it would be like today when social media, again, we couldn't share this kind of stuff. But
2000, let me just put the chronology together, Kim. So 2004 is a year after Woody died, and more than 10 years after they had hearings already, or they'd had sort of an, some conversations, and they knew that these were side effects that were possible for people. Do you draw? I mean, to me, it sounds like your advocacy and going to DC and showing up at their doorstep and talking to your representative might have spurred some of that. Are you just being super humble here, or what actually
Oh, I
happened?
mean, probably a little. I mean, we were like relentless,
Yeah.
and we met with we would bring families together because literally, and it will make me cry. I think about like I mean, Woody became like kind of the poster for adults because he didn't have a history, so they couldn't blame it. But then I think about my friends whose kid got it, like a little 13-year-old got it from moving. They were moving from another city and he was stressed. They put him on Zoloft, and within a couple days he hung himself. And then Pfizer tried, because there were big lawsuits at this time, tried to make it seem like it was a sex act gone wrong, which is insulting. And then my other friend whose kid got it for test anxiety, and she on Christmas Day was just sitting in her dad's arms and then went upstairs and hung herself from the valance of her 4-poster bed. And so you're hearing all these families. I'm like, help me understand. So I couldn't, because I knew that God gave me an ability to fight for something, even though it was too, like, I started learning all this stuff. Like, what good would have it done me? Because I already had the information. It was way too late. We blindly trusted. So I didn't have any of this. And I kept thinking, what if somebody in 1991 had the ability like I do? I wouldn't even be here because we would have had warnings on these drugs, right? So I felt like it was my kind of responsibility to do what I could do to make sure that somebody else has a chance that we didn't have. So yeah, that's kind of what, and the lawsuit helped a lot because my lawsuit against Pfizer, it wasn't just my story. So the other big component of this was I had the best lawyers out there, and what they were able to do is they got a bunch of documents out from under seal that showed that the drug companies, the FDA, and Pfizer all knew about the link between suicide and violence for a long time. So it's interesting because when you do go out to DC, you have to be very careful about, like, it's not just your story, because they can't do anything about the stories. It's really, I mean, you use that, but it's really like what you give them something. And so we brought binders worth of documents because it wasn't my word. Like, yeah, Woody's dead, and all these other families that we just told you our stories are dead. But when you see it in black and white on Pfizer letterhead, at the FDA letterhead, and the dates, like, how do you not like say you have to do something? Like, and this includes.
And so to clarify, they knew about it from their own pre-release trials and from their own data collection before the drugs were approved.
Yes.
So how does a drug, so if the FDA knew about it and Pfizer knew about it, the drug maker knew about it, how did those drugs get approved?
Well, it's interesting. Well, first of all, you have to realize that with all drugs coming to market, which I didn't know this, who controls the drug studies? The drug companies do. So being a business person, like, I understand, like, why would you ever put like failures in there, right? So at that time of these clinical trials, you only needed 2 double-blinded placebo. That was considered the gold standard. Although today, when I'm sitting on the committee, which is the same one that in 91 didn't do their job, most of the trials are even aren't coming to market with 2 double-blinded. They're using fast tracking. So we can talk about that in a little bit. But so in the case of Zoloft, and the reason we were able to find this out is through the lawsuit, that the bulk of the trials, the initial trials that they did, placebo outperformed the drug. And so they had 13 or so. And then the only 2 that they presented were marginally better than placebo, the drug was, marginally. And so that was, I don't know that the FDA knew that per se at that time, but they knew about the links back in 91 because they held hearings, right? And their own so when they started looking at post-market, when people like, call in and, say, or the doctor reports side effects, one of their own researchers, Andrew Moschholder, who he's the one that analyzed it and said there were links between suicide. So, but the officials, some of the top officials at the FDA, the ones that I call now are the ones that go revolving door, because there's a lot of really good people at the FDA that actually want to do really good work, but they get suppressed by leadership at the FDA.
And the revolving door you're talking about is the door between industry and FDA. So basically the people who make the drugs then later go into jobs at the FDA where they're approving drugs from the company they just came from.
Yep, and vice versa, and back and forth. I mean, it actually, again, from a business, it's a pretty smart business move, right? You got to go into the regulator, because what I have learned is the regulator, the FDA, is really nothing more than it's a hurdle that the businesses, like, they're trying to, they have to go through the FDA to get their product on the market. So it's a business. And that is the thing that I have learned throughout this whole thing. It's a business. I used to always think like, oh, they care about our health, but no. And so I always like to call patients customers. It drives my patient safety people crazy a little bit, but I'm like, well, you have to have customers to make money, and the shareholder, like, you're only really accountable to the shareholders, even at healthcare systems, like so anyways, I've learned so much. And then through these years, that all started with something, like horrific. But the FDA, going back to those documents, we got an internal document out from under seal that was in Pfizer's files that they were discussing. It was during the AIDS crisis. Remember when the pressure was so, the community, the culture was, the FDA is too slow. People are dying for AIDS. We need to have more faster approval. So it was during that time. It's a memo. I have it. I mean, I tweet it all the time because these are all open to the public now. But they were talking about, unless there's it's a 3-page memo specifically about Zoloft, unless there's a significant sea of change towards society's view of the FDA not being fast enough, right? That's part of the letter. And the very last sentence says, we're going to probably come under attack years from now for not being as demanding as we ought to be for establishing the efficacy of antidepressant products.
And that's from the FDA.
That was the FDA's own internal email, like back and forth between department heads.
So basically that was them saying, we put this through, we let it sneak through, but we all know that it doesn't actually work better than placebo.
Yeah.
In fact, I think the only thing that works better than placebo for depression is exercise. None of the drugs, right? But they basically knew that, and they were like, history, we're on the wrong side of history here, but we're going to keep going because we're making money. And for now it's,
you start, and then like another document that came out from litigation. It's why I believe in the power of litigation. Yeah. Because it becomes, do we have to have litigation? Because if there's litigation, that means somebody got hurt, right? Or there's some problem. But I didn't realize that in Germany, the German back in the 80s didn't approve Prozak initially for 2 reasons: risk of suicide and violence and lack of efficacy. And that's their letterhead on their paperwork. And eventually the German authorities did approve it, but they recommended it with a tranquilizer for offsetting the side effects. Mm-hmm.
Wow. Yeah. Okay. So people who have never been on these drugs or don't follow this story would probably want to know at this point, well, what's the current, I mean, that was 20 years ago. What is the current status of these drugs, which is the, selective serotonin reuptake inhibitors, the SSRIs, Prozak, Paxil, Zoloft. It's like, what is the current status of these, and how do consumers learn about these things? Is there any kind of warning now? I mean, I kind of know the answer, but I want you to tell it, and I want you to take ownership for your impact on this, because it's a huge deal.
So in 2004, we got warnings, black box warnings for kids up to age 18. It was still not good enough because we wanted all ages. We pushed for all ages. Ultimately, the FDA added up to age 24 in 2006. To this day, there is no warning for all ages. However, all ages are at risk, and their documents show this. So, so to this point, and what we have now is, we have a growing mental health crisis, and the prescription rates are skyrocketing. I really thought that back in 2004 and 6, that people would start, like maybe it would impact, which is, everybody was afraid back then. They're like, you're going to take away our drugs. They saved our lives, whatever. My thing is, no, people, it's called informed consent. People need to be warned. But that same thing is happening now, 22 years later, with RFK taking over and this being part of the MAHA commission. It's actually now a part of, for the first time, and I'm super excited, I've prayed about it every day, that we're going to look into the prevalence of antidepressants and other mental health drugs like the stimulants, and on the global mental health, or at least mental health crisis in America, right? And so this is the first time we're going to investigate what kind of impact have these drugs and the long-term use of these drugs has done. And just this week, there was a study that came out that with the long-term drugs use of antidepressants, there's a link to dementia. And so that one just came out, and which always kind of made sense to me, because I'm like, when I know people who have been on them for 30 years and they won't get them off, but they're not daily vitamins.
Yeah, well, I mean, here's what I want people to hear, because there are probably people listening who are like, oh my God, I'm on one of these drugs. Should I be off this drug? And my guess is the answer is we don't have the studies. Maybe Pfizer has these studies, but we don't have the studies, right? How do we know if someone's been on something for 10 years, what's their risk of suddenly having a side effect that they've never had before? Like, are they in the clear if they don't have the kind of symptoms that Woody had within the first few weeks? Or is this something that over time can become a problem? My suspicion is, if you're not a person who has a side effect like this, it's probably not going to be something that you have to deal with. But we don't know that, right? Like,
that's not true. So the most dangerous times with, there's some other side effects of the drug. And first of all, if anybody's on it, this is not about pill shaming at all. This is about information that I learned, and it's about being informed. And so anyways, I always have to say that. So the most dangerous times of medication are when you go on, or when you go off, or you try to dosage change. And so what has come out is a lot of people can't get off these medications, or they might be having side effects and they're not recognized by doctors. It might be hallucinations, or they feel like they're not getting better, and they get more drugs put onto their prescriptions, their daily prescriptions, to deal with side effects. Some of the other things are just kind of emotional blunting, sexual dysfunction, where that could be that could exist years after you go off of these drugs. Now, other countries warn. There's we're still waiting for that warning here in the US. And so, like, that's a pretty big warning, even though it's not like you go kill yourself. But
hold on, you said waiting for which warning? The warning for adults, or the warning?
Yeah, for anybody, for sexual dysfunction. That's anybody who's interested in that. The persistent sexual dysfunction is a big area that is being studied. So a lot of these studies that are happening by other people outside of like pharma, because most, they look at what's going to, they're tested for 6, 8, 12 weeks. And then everything else is, we discover in the real world when you and I take drugs. So, so that is not necessarily true, that if you didn't have this, then you're out of the clear. That's not necessarily true. And there's a huge growing network of communities coming together because they can't get off these meds, or they're having all these side effects, like akathisia, which is one of the boards you had mentioned that I'm on. Akathisia is the side effect where it's a neurologic, and it impacts your neurological system, where you kind of feel like you're moving, you scratch, you're kind of moving, like could be like tics, etc. For Woody, it manifested in head outside the body. And if you and Pfizer actually talked about that in a journal article, which was public, that said that if a person gets akathisia, quote unquote, death can be a welcome result. Now that's what they wrote, but what they didn't, what wasn't in public was they intentionally told their salespeople not to tell the general practitioners about this. But 70 to 80 or so of the meds are written by GPs. So they intentionally did not, they kept this whole neurologically inclined kind of side effect. So, you
So they
know,
basically reserve that for the psychiatrists, but for the
yes,
general practitioners prescribing 70 to 80% of which of drugs were coming from them, they just omitted that. They didn't tell them this could be a side effect to watch for. And so
that's,
help me understand, death is a welcome outcome. Does that mean they're just saying it's so bad that people want to die?
yeah.
Who was that? That was a public facing article? Like
Yeah,
what?
that was in a medical journal that Pfizer's chief medical officer, Dr. Roger Lane, wrote about, talking about, and a lot of these medications can not even just antidepressants, other meds. It's something that's in the neurologic system, but it's so distressing that death can be a welcome result. So it's not like the disease is killing them. It's that the side effect is so distressing. So I
Yeah.
think it's one of those things that, when you have this, you know about it, but you didn't tell the GPs where the business is, right? That's a business decision. And so that's what I, learned through this whole experience for me. And it probably started a lot even earlier. For like just questioning this, because I remember I helped start an organization where I worked with abused, neglected kids well before Woody died. It was using the power of community and volunteers with these kids that had been removed from home and had tragic experiences. Well, and using art. But anyways, one of the nights, and this is again kind of our culture that we live in, like throw pills at people. One of the we were at the group home, and the staff said, "Hey, kids, you want to show the volunteers where you live?" And they're all like, "Yay!" And so we went up. These are 8 to 12-year-olds. Went to their locked hall that was like a dorm room. Every kid picked up a cup of meds. And I remember like, oh, because I'm thinking, oh my God, this is going to be, they have strep throat. I have to take an antibiotic, I have to swallow a pill. And they're like, oh no, this is their behavior medicine. I'm like, behavior medicine? Like I'd never heard of it. Then now I fast forward and I learn about the Medicare system, the Medicaid system, and how the system is so like, we're just, like, I think are just kind of taught to like throw a pill at them. Like even after Woody died, the doctor said, do you think you need something? And I go, well, I think the pill is what killed him, which I think she thought it was crazy. But I go, but aren't I supposed to hurt? Like, Woody died. And she goes, well, you don't need to. And so right there was kind of this another like, oh, wait, I'm so glad I didn't go down. For me, like I chose not to because of just what I saw, but I can't imagine 20 years later what would my life look like if I had just numbed it all out, because I have learned that what you resist persists anyways. Like it doesn't get to the root cause. It's still like, yeah, Woody's dead. And that's what you have to like make sense with and live with and learn to dance with this thing. So
Yeah, it's new reality. Well, I mean, your story is so powerful, Kim, and it's really just a testament to your kind of, I mean, you used the word persistence before. I mean, you're like a bulldog. You're like a warrior on fire who's been called to this mission, been thrust onto this journey, but like you don't say no to it, and it's really powerful to witness.
yeah, I haven't stopped, but I also now started to go, oh wait, maybe I was always kind of met like this because of the way I grew up. I used to complain about my dad being like nonstop, you got to work, so I feel like some of this maybe I got from maybe I was planting seeds and also making peace with stuff about my parents growing up and, coming, I don't know, maybe it's getting older, but I'm kind of making sense of like like what we're all about in life as
Well,
people.
you're reflecting, right? You're being reflective about a journey that's it sounds quite intense. A lot of the pieces that you've shared have been quite intense, and it sounds like you're reaching a point at which you can slow down and start to reflect and think about it and make sense of a life, right? And of a
Yeah,
movement that you've created that's had some major impacts on drug safety in this country. Things that if they'd been in place, Woody might not have gone down the path he went down, right? So
yeah.
thank you. Thank you for that. I wonder, I guess I keep thinking about to what, like how much of this advocacy and the work you've done and the mission and passion have been healing for you, and to what extent have they been distractors from your healing?
It's a good question. I think because I've, like you said, I think you said it well by reflecting. I think initially, well, for sure, I think it was a part of my healing process, right? But it was also a deflector, right? I got to throw in all of my energy somewhere else, and I didn't want to still feel this. So this gave me something to do with like my anger and all the places, everything that they say about grief, like anger, sadness, like it gave me all of that place to throw it. And it also gave, I think it's David Kessler who said the sixth stage of grief is kind of this idea of doing something with it and positive. So I think I did have that. But what I realized for me is I didn't still do this work. And I just probably in the last, I kind of went into a relationship because I didn't want to feel this. And when that ended, which I knew it should have ended a long time, but I was so afraid of being alone. I was so afraid of feeling the things that I needed to finally feel that when that ended, I had to now go back and deal with this, my heart, and to deal with the real healing for myself. And but during all this, like I didn't go the pill route, obviously. I chose to feel it. I felt this anger, which is where I was able to throw it. But I've also did a lot of my own. I have like an amazing integrator. I call him my kinetic. Well, he is a kinetic chiropractor, but like how he's like, oh no, it's showing up in your shoulders or your rib cage, but it's not actually coming from there, Kim. You have a lot of like. So I am a big believer in somatic healing, working with your body because your body has so much wisdom. I look back at, I did something called Rolfing, which I knew nothing about it. I thought it meant like throwing up. But it was a session that somebody had said, hey, have you ever done Rolfing? I'm like, well, that sounds interesting, whatever. So it was like when they got to session 6, which I think is your diaphragm, and she was working on me and literally unleashed. I didn't realize all the grief and the trauma and that I held in my body. I bawled for 2 hours on the table. And she couldn't even get me. She's had other people. She had to leave me there. I was just like gut wrenching. And so that was like a big aha of like, whoa, how many things have I like over, and not just with Woody, like, holding your voice back, my 2 places in my body that I can feel when I tense up, my breathing and right here, because those are the places so I learned a lot about body work for my own journey, as well as the reality of I wanted to move right after Woody died. I've always wanted to go to LA where I did my work. And I remember going, I'm moving. And then my grief counselor said, well, that's great. Remember, wherever you go, there you are. Meaning you can keep running. You can keep running, but at some point you have to, I call it the mirror. You got to face it.
Yeah. Well, hats off to you, Kim. I mean, it sounds like you've been on a real journey, and you're not done, and none of us is done, right? So I'm inspired by how well you're just intentionally leaning into it and collecting a healing team of people and being very methodical about peeling the layers.
I always say I've got a team of people because I think it is, I think healing, I go back and I think back to, as a kid, I never liked meds. I just never could swallow. So I would always go to the bathroom and just flush them down the toilet. Like I got antibiotics, I just go throw them down the toilet. Then I remember in college, like all the pieces are starting to fall together for like my life. I always had this, like, I always had phlegm at my throat, and I graduated from college. My mom was a pediatrics nurse at a clinic. So I just always go in there and get meds for free. Like asthma meds or whatever. I haven't had those for years. But anyways, I go to this doctor and I was telling him about my throat, and I had this phlegm all the time. I could never clear it. And he looks at me and goes, well, you're just stressed because you don't have a job after graduating. And I'm like, I don't feel stressed. But anyways, he gives me a prescription of Valium. And Valium, yeah. And Valium. And I remember, like, and this is a long time ago. And my mom goes, I went down and showed her. She goes, you're not taking it. So she ripped it, right? Fast forward, I started realizing, like before, again, Woody died, I was trying to have kids. We couldn't have kids. And so I went to a nutritionist, and she goes, you look like bread. You're puffy. I think you have candida. And so then I started learning about like how important like our foods in our body, what we put in our body, and how that impacts, and like exercise, like all these things that, again, before Woody died, that I started to have to tap into, and didn't realize how they're all kind of interconnected with healing.
Yeah. Well, and it brings us back to this idea of a broken healthcare system, because those things are not taught to doctors in medical schools, right? They're not taught. No drug rep shows up with like whole real foods and vegetables, and gives a free meal, free breakfast to you at grand rounds or during your morning report, because that's not who's funding and subsidizing our medical education in this country, right? It's the pharmaceutical companies who show up with the big fancy breakfasts and the big fancy dinners, and after you graduate residency, call you up. They find you in your practice and say, hey, we're hosting a big dinner over at this really fancy, expensive restaurant that we know you couldn't afford when you're in residency. Let's come host you. And then they give you a talk on their latest and greatest drug. And they're super charming, and they're super beautiful and handsome. And it's very compelling for doctors to just be like, wow. And then they fill your drug closets at your office. Imagine if we had huge corporations that were filling our offices with big boxes of like family-owned bio,
Yeah.
what's the word I'm looking for? The organic biodynamic farm produce, right? Like imagine if that's what we were being taught to push on our patients, what a different world this would be. Which isn't to say that there isn't some value in drugs. There's a lot of drugs that I rely on, right? And that many of us rely on to survive and stay well and get well. But like we need more information and clarity about the side effects of things that we're going to put in our bodies. So
Yeah.
talk to me about med school, because I think you were telling me you've got some things you're doing with medical students these days, right?
Yeah. Well, it all started from when I learned, just with my experience of like going out and doing my research in FDA, I go, wait, when I found out doctors don't learn how the FDA approval process works, and I was like, you don't learn about that. And then I learned they don't learn about nutrition, and they don't, and then I started going, who is funding the med schools? And you start looking at who's responsible, who's behind everything, and where's the money coming from, and the research grants, and everything comes back to what I call the spider web of the everything that's got the doctor-patient relationship, the doctor as an individual, the patient as we're all trapped behind this, like the money, the system that keeps, and like a spider web, some is really, you can see it, and others very like sticky and you can't see it. Well, med schools, when I learned that funding comes from industry, and then I learned a lot of this because I would go to, and you touched on it in the introduction, the Selling Sickness conference. I love to travel internationally. I love going to conferences. I would go to conferences with my lawyers all the time and learn. And I went to one that was put on by the Dutch government in Amsterdam in 2010. And it was all about all of the, like basically the trapping, like the med school, the ghost writing, right? What is a ghostwriter? Writing medical journals that then they have to put a doctor behind and put the name on it who's getting paid by pharmaceutical companies, but it's running in the medical journals, or the medical journals, the peer review system. Is it really peer review? We learned about key opinion leaders, which are these big conferences you're talking about that might be in Hawaii that you're going to go to, but who are the people that are up at the front talking? They're probably being, even though they're like the world-class leaders, who are they being funded by? And so then you start looking at screening tools. So I started learning about this, and they were all coming from the US, which I thought was very interesting. And they had this conference over in Europe being attended by all these countries. There was a handful of us from the US that were lawyers, me, and one other advocate. I'm like, why isn't this conversation happening in the US? Well, then I found it's because of who controls everything in the in how doctors are learning, right? So if they keep us kind of blinded, meaning the consumers, I mean, obviously we have direct-to-consumer advertising. We're one of only 2 countries for the US for consumers, but for doctors, there's all kinds of stuff that's happening behind the scenes that they're blindly trusting too. They're blindly trusting, and we're blindly trusting, and yet we're the ones that have to go to the doctor. And so the whole system is in this blind trust. And so one of the things, I don't get invited. I had somebody, I did a podcast on American thought leaders, and I got I think it was American thought leaders a couple years ago, and one of a professor, head of at WashU, saw it, and he invited me to come and do a big talk at their med school. And it was fascinating because I was like, wait, if we could get there. And it's not about like taking meds or, you know, what you just said. I think it's just about this idea of learning critical thinking, that if our doctors can think like, oh, wait, is this key opinion leader? Who's this a doctor who wrote this journal? Could I go research? You know, I mean, just to even know where the traps are. So I got to go speak. It was amazing. And afterwards, I think it was the head of psychiatry, but both people had accents. So I knew they weren't from America, and they both came up to me and said, we've never heard this kind of talk in the US. And I'm like, yeah, where are you guys from? Because clearly your accent is not from from the US. And sure enough, so I think it is a big American problem that obviously trickles down. But when you have Americans at 5% of the world population, 4 or 5%, we're taking 75% of all meds, like something, and our health isn't exactly getting better. And if the whole model is like, give a drug first, I think there's just a lot of things that the system is kind of, again, I go back to, it's a business.
Mm-hmm. Yeah, it's a business. And I think if people kind of go into their encounters with the medical system with this idea that this is a business, buyer beware, meaning be aware that you're here as a consumer, which means not only do you need to sort of ask really good questions until you leave with an answer that you feel you have information to support your decision, but also to recognize that there's some biased actors here. And I agree. I think most doctors don't know that what they've been taught is biased information, right? They don't, I think the assumption when you're in training is that you're learning this world of medicine, and there's, medicine exists in a big pie, and there's maybe a little slice of the pie that's sort of not what we learn, right? But we learn that it's not important, right? That's not actually, we're not learning it because it's not valuable. And those are things like nutrition and exercise to some extent, and all the different other ways of being healthy. We're learning this other pie. But I think that actually the image is inverted. I think this little tiny slice is actually what is out there in terms of interesting and helpful and potentially useful medicine. And the rest of it is what we don't learn in medical school. So I love that you are sharing this with medical students. I'm sure it blows their minds. I'm sure that there are people in the audience who, some of the attendings are nervous because it really challenges the whole foundation on which the medical education system is currently based.
Well, and I think there's I had somebody who said, well, I do a lot of speaking. He heard himself because I was challenging the word of a key opinion leader and who they are, and that they're marketing companies that do nothing. Their entire business is to go find doctors that can align with either their disease expertise or medicine expertise. And then they work with the drug companies or the companies to align. And so that's their whole business, right?
And what does that mean? Hell, break that down. What does that mean to align with them?
So that let's say you're a key opinion leader, and I'm gonna you're the leading. You've got a very interesting belief on cancer of some whatever kind. I might hire you and give you all this money to come speak, not because you're out pushing a drug, right? So this is where you don't even the cognitive dissonance. You don't even think you're being used, but you think you're talking about your expertise. But the company knows that they've got a new drug. They know that there's something in the pipeline that's going to fit right there. So then this person becomes the expert, then they use it and becomes like a platform eventually for them to sell it.
The marketing.
It's a part of the marketing arm. And like I said earlier, I'm in advertising. And so I've still am in advertising. I've never worked on pharma. But I have to go and understand the business, I've worked on major companies and major type of industries. And so this kind of way my brain thinks is kind of what we have to do all the time. Like go understand the business model, go in and understand where's the potential, where are the red flags, where are the, what's their competition doing? So I have always my brain just naturally thinks that way. So I'm like, oh, so when I learned about key opinion leaders or the screening forms at your doctor's office where it says you get them at the time of insurance where it says in the last 2 weeks, have you felt sad? Have you felt the PHQ-9 form? And because I helped create the area that I worked in, the one agency was when lease ads for cars came out, where I learned that you can't, might advertise $100,000 car for $299 a month. So I had to go, it's always in the tiny type, right? You always want to go look at the tiny
and the really fast words at the end.
And I always go, you got to go look see what this print says, because that's where the truth lives. Well, when I saw the PHQ-9 form, nobody taught me this, but it said a generous donation by Pfizer Inc. and 3 doctors who are kind of the leading psychiatrists behind meds. And I was like, wait, this is like a sales tool. It just gets people in the funnel. And so now, and this is what I would tell your listeners, for me, I won't fill it out. I just refuse to fill it out. And with the insurance, or when you go to the doctor and they'll be like, well, I need that form. I'm like, I'm not going to fill it out. So it now says in my records, she is not going to fill out the PHQ-9 form, but I'm not going to, because it doesn't first of all, I will tell my doctor if I have something, but that doctor is probably not who I'm going to go. I have other people I'm going to
And so just for general information, so the PHQ-9 is a 9-question assessment tool that Pfizer developed, right? That basically funnels everyone towards their drugs, because it's hard to take the PHQ-9, especially on a bad day. You could be a perfectly healthy, happy person. You take it on a bad day, and it's hard to take that and not get at least a flag that's going to come up in the doctor's system that says, better ask them if they're depressed, because it looks like they scored this number on the PHQ-9. So it's basically a really overly sensitive test to look for depression. And
I like it, but I like it. I like this idea that, if it gives you this ability to, so I feel like a lot of these things are created in this healthy, or it's a really good thing, but it's kind of got this other undertone to it, because in that there's no context of in the last 2 weeks, or if something happened, you just got in a major fight, you got fired, you had your kids and you had a massive fight, there's nothing.
Right, because our assumption is it's normal to have ups and downs of mood, in relation to the vicissitudes of life, right? But I think we've all we've started talking in such a way that it makes it sort of not normal if you're having a bad day, or if you've been down, or if you're crying, or if you're, experiencing a loss. So I also wanted to say that the PHQ-9, and this gets maybe to the broken, the web you're talking about, right? Where there's all these different nodes of the web and different pieces that are connected to perpetuate a system that can do real harm. And that's that the doctors who don't click a button on their EMR that says the patient filled out the PHQ-9, or we gave this to the patient and got a result, that shows up in their metrics. And so they can get dinged for not doing enough assessment, or if you didn't ask about smoking, if you didn't ask about this or that. And that can create an incentive for doctors to kind of push those tools, even if they're not helpful, or even if they're overly diagnosing something that then leads to a quick, oh, here, take a sample of Prozac or Zoloft home with you.
Oh, so it's another element of see, I always love when I talk to doctors or people in the system, because they give me other things that actually should be in there too, that they aren't even aware that if you're getting dinged as a doctor, like
potentially. It's sort of, it can depend on what your practice has decided, what metrics you've decided to collect and look at, what you think matters for your population. And sometimes these things are linked to insurance reimbursements, right? So if you're not clicking enough boxes, you may not get your insurance company, if they do an audit, or if you have submitted those invoices, they may not reimburse those visits at that certain rate.
Oh, yeah. So it does come, there's a lot of different levels in the work.
Yeah. Okay, so this has been fascinating, and I'm so grateful for you sharing this story with us, sharing your time, and also for sharing your time and your talent and your passion in all the ways you have over the years, Kim. Is there anything else that you would like to share with this audience of wellness seekers, people who are looking for, maybe people who are interested in learning more about resources that you have on your website? What would you share with them in terms of next steps and last thoughts?
Yeah, I would say, well, first of all, I love having these conversations, because I feel like it all starts with having conversations and being willing to learn from people. And I always say, don't even believe what I say, just be curious, because I think I think curiosity is like a big thing that we do have to have as part of our own journey in anything. Just being curious helps, and having conversations. I also will say that I have learned that no one is ever going to care more about you or your health than you, and your family, than your families, than you. No, like the government's not, the doctors aren't, because ultimately if something should happen, or you're the one that still has to live with it. Like, somebody can give you advice, and they could have advice with the best intention, but you're the one that still has to live it. Your kid still has to live with it. And so I think that idea, I wish I didn't, looking back, if I was to do things differently, I think we would have asked more questions. We would have not just blindly trusted. We would have asked, are there, in my mind, what informed consent is, of course, the system's going to tell you the benefits, but I want to know the harms. I want to know the rate of harms. I want to know the clinical trials. I want to know what would happen if we did nothing, or if we did this other, other way of dealing with something. So I say, ask questions, and also don't be afraid to challenge. I had to have some surgery, it was an endoscope, and I'd never had an endoscope before. And I kept asking the doctor all these questions, and he finally got mad at me, and he said, oh yeah. And he said, do you know how many of these I do every single week? And I was not insulting him at all. Instead, I was afraid that you were going to, I have never, and I looked at him and I go, I have never had one of those in my body. And you're putting that in my body. I'm just asking you, how about the fact that I'm afraid? And he just I hope. And so I realized that when I told that story to other people, they're like, oh my gosh, I just don't feel like I can say anything. And I go, they just might have more education than you, but that doesn't mean that you don't know. Like, I wish, that we have a lot of wisdom that lives intuitively if you listen inside your body. If something doesn't make sense, it's something that doesn't actually make sense for you, and you should go investigate and do a little bit more or challenge. So that's just kind of my overall thing that I've learned, that I wish I did. And then I would say for resources, if you're in a situation, I think support groups are great, now, especially if we can have them and they're open. But I have on my website information like in the psychiatric world of like Mad in America. I have a bunch of resources. I have people who are trying to get off of medicines, another organization, Inner Compass. I think finding, the board that you and I are both on with conscious, clinicians, I think is really an amazing trying to find and asking questions of and your physician, are you in alignment in how you think about health? So those are some of the things.
Thank you. We'll put links to all of those things and more information about the Conscious Clinician Collective as well, because I think you're right. It's such an invaluable place for people to eventually will be, right, when we really build it out, for people to go and find physicians who are willing to have conversations without getting defensive, and saying things like, do you know how many of these I've done? Like, I mean, there's a reason people don't want to ask their doctors questions. They're afraid of responses like that. So good for you for pushing through that, because a lot of people can shut down. I sometimes shut down in the doctor's office when I get a pushback like that from a fragile ego that just got stepped on.
Well, and I think you're, again, I was not this person, but after I've learned so much in this space, what I learned is through some of the worst times in my life, I actually found my voice, and my voice is like, oh, wait, it matters. Like, so your voice matters. And just because you're going to ask a doctor something, like, your voice matters, and your voice, like, that's the biggest thing, is that you matter as a person. And so you are worthy, that you should be able to ask a question. No one's better than you. And like, this is, what I've come to realize, that why can't you ask a question?
Yeah. It's a good question to leave all of us with, right? Because I think it's a challenging one, and also one that is worthy of us overcoming. So that challenge. Thank you so much, Kim Witczak. It's been lovely.
Thanks. I loved having this conversation. I could talk about this all day long.
I hope you enjoyed this episode of the Healing Grove podcast. If you liked it, please be sure to like and subscribe. And if you want to deepen your experience further, consider grabbing a copy of the Healing Grove Playbook. With journal prompts for this podcast and 41 others, it's the perfect place to record your learnings, keep track of the tools you explore, and reflect on your own experience. Finally, it's important to mention that even though I am a doctor, nothing you hear on this podcast, whether from myself or my guests, constitutes medical advice. Any intervention you try should always be discussed with and supervised by a trusted member of your own healing team. Thanks for listening, and see you next time in the Healing Grove.